and the Director of Public Health, Jim Austin. He called in. We're going to do a couple of slides, do some information. We also have some documents that we can send out after this call, and then we're going to leave the rest of the call open for Q&A so we could talk about how to stay open safely, what it's going to look like with the more winter holiday foot track coming in, and we want to make sure that everyone is prepared here in Montrose County. So I'm going to hand it over to Hansen. As a reminder, you guys are all on the webinar, so keep your computers muted if you aren't talking, so that way everyone isn't talking over each other. And we're also recording this call for you guys to view later on. So I'm going to hand it over to Sue.
Great. Thank you, Kate. Appreciate it. Hey, welcome everybody and good morning. We think it's past time that we give you all some information about what's going on with this pandemic and kind of update you on the county and the city position on businesses. Obviously, before we get started, I just wanted to know that the stress that small business is under is not lost on us. We understand that that there's an awful lot coming at you, notwithstanding the state guidance, the county guidance, and also your pressures from your patrons. It has probably not been a fun time to be a business owner. It's also not been a fun time to be a county commissioner or a city council person. I just want you to not that we expect anybody to feel sorry for us. That's the job we signed up for, but we're managing a situation that people have, there's no hard facts for, and it's kind of a moving target, just like owning a business. And I also wanted you to know that both Jim and I have been business owners. We understand what it means to make payroll. I remember many sleepless nights just making sure that we could have enough money in the bank to make that payroll. So we get it, and we support small businesses. It is the backbone of our community, and so I just wanted you to know that your situation, we get it, and we support small businesses, and we want to keep small businesses open because again, there's a lot of fallout when you start having people out of work, and it causes a lot of even that much more stress. So I'm going to go through a few slides and it's going to be very quick. Jim's going to handle the business guidance. I'm going to just give you some background on what's going on just with the COVID situation. And then we're going to open it up because I want you all to leave today with a clear understanding, as clear as we can get, to guidance for you all within your small businesses. And I encourage you to reach out to the city and the county. We are more than willing to have conversations with you whenever you need to have conversations. So with that, let me just go ahead and get started. The first thing I wanted to do is let you know that, and you probably already know that essentially cases are on the rise. We're seeing across the state, nation, obviously we have a virus. We knew it was going to spread. It's like any other virus, with the exception of that, it's more highly contagious. But we want you to know that we expected cases to be on the rise. We've predicted these spikes, and it's been kind of a fluctuating up and down with regard to the case count. Just want to direct you to MontroseCountyJIC.com. I think most of the information that you are going to be interested in is going to be on that website, and that link is really useful for business guidance, for connections and links to the Department of Labor if you have labor questions. We just want to make sure that you have all the information that you need and want. The largest factor for spread is community spread. That means people are getting together. They're getting together in groups outside of your workplace, and that's where a lot of the spread is coming. And we want to make sure that you know how to handle your employees and what to do when your employees either have symptoms and that kind of thing. So the community spread is up. We see it all the time, and we're seeing that constant increase. The county and the city are encouraging you to make a plan and you to talk to your employees about making a plan. That means that if somebody tests positive and they have to quarantine and they live in a family unit, they're going to have to, define a room that might be useful for that, so that you can adequately quarantine and isolate. And the most important piece here, and we're going to cover it time and time again, is that we want people to stay home when they're sick. We are currently in the orange dial, which is reduces mostly on, the impact is mostly on small businesses and restaurants, reducing the percentage of occupancy. Again, we're teetering on the red, which even takes it to a higher level of restriction. You can find out more about the specific restrictions on our website and on the city's website. So we are preparing for the future. We want to make sure that everybody is knowledgeable about what's going to happen. But I want to just take a second and talk about tests. You know, we have in the community, you hear people just running to go get tests, and if they test negative, they feel like they're fine to go back to work and everything's hunky dory. I want you to understand that just because one of your employees tests negative does not mean that they couldn't contract the virus in the next day or so, or that they don't have the virus. So instead of mass testing and running down to Delta, and people have asked us how come Montrose County doesn't have a free testing site, because we don't support that broad-based testing for everybody that just wants a test, because it is fooling people into thinking that they're safe. So when they think they have a negative test and they think they're safe, they're essentially gonna go back to work. You're gonna let them come back to work, and that may not be the right solution. So symptoms mean that if someone has any symptoms, you really wanna make sure that they are staying at home if they have, just like if they had a flu. You don't really want people to come to work if they have the flu. You don't want people to come to work if they have COVID. So the testing has really been a little bit of a problem just because everybody thinks that's the answer. And I can answer questions about that if you have any after that. Jim, do you want to cover the county position on businesses? Jim, you're probably muted. Jim. Okay, so let me just cover that for Jim. The county position and the city position, and I didn't put the city in here, but we support businesses. The city does too. Most of the businesses are in the city of Montrose, but we recommend that you do all the annoying things that we've been asking you to do, which is the mask, the distancing, and set up your businesses just like you would to make sure that people are safe and that all your patrons, whether they're masked or unmasked, are able to come in and be able to patronize your business. We highly recommend mask use and social distancing and all of the cleanliness, the practices that we've been talking about, and you're probably sick of hearing about. At this point, we do not have any plans to close any businesses. We are going to launch a new campaign called Stay Open Safely. I'm going to tell you about that on the next slide. But I put the number down here and we'll send you these slides, but you can call our public health department anytime. The number is down there on the bottom of your slide, and you can call me personally. I have found that some of the one-on-one conversations I've had with business owners to be some of the most valuable for them and for me in terms of getting people accurate information. At this point, when you have the CDC national level, you have the state and giving guidance, and you have the county giving guidance, it can be very complicated to figure out who you should talk to, what are the rules, and what does it all mean. So I am happy to have those conversations with you anytime. And at the risk of being really busy on my cell phone, I'm happy for you to call me at any time. We are also encouraging people to make a plan. And I mentioned this a little bit earlier. We want you to talk to your employees about, you know, if in fact they are positive, what does that mean? Does that mean they still get to go to the grocery store? Does that mean they still need to be out and about in the community? If they test positive, they really need to be home, and it's better to have a plan ahead of time. So the plan would include making sure that you have a primary provider that can manage your symptoms. So for instance, if you go get a test and you test negative, but you have symptoms, what are you going to do? Are you going to call your provider, which is what we recommend that you do? We recommend that you have a medical provider that can actually manage your symptoms. You might just have the flu. And if you just have the flu, there are therapeutics that can take care of that. So we think that's really important for you to think ahead and encourage your employees to think ahead. What would happen if? Good content for a staff meeting just to discuss in the event that this happens, what might you do? So we will be rolling out make a plan language and campaigns, and we're going to talk about that a lot going forward, because what we find is that people, they question themselves about what do I need to really do? The Stay Open Safely campaign. We will be, essentially, we want you to stay open. We want you to do it safely for your patrons. We do not want any of the businesses to become an outbreak site. It's not good for business. It's not good for PR. So we will be launching this Shop Local Colorado and Shop Stay Open Safely, which will mean that we will be suggesting all of the safety measures that we've been talking about. It's washing your hands. It's all common sense, folks. You guys are business owners. You've been running your businesses for a long time. You know what common sense is. So if in your own businesses, you make those decisions based on your own best judgment. And we recommend we have some gift bags, we have some masks, we have some information sheets that you can post in your place of business, and also a sheet on guidance if one of your employees tests positive. Don't forget that Region 10 and the city, I think, still has some grant opportunities for businesses. Do not let those go untouched. Please reach out and make sure that you take advantage of those if you need to in your businesses. Again, we are asking businesses to do what businesses are not normally asked to do, which would be to limit your occupancy because of spacing distances and things like that. So again, trying to stop community spread is one of our goals. So also the ambassadors, as I said before, they will be stopping by just to say, hey, what can we do? What do you need from us? How can we help? This is not to mandate anything. This is to give you all the current guidance so that you can make the best decisions for your businesses and keep your patrons and employees safe. And then if you have anything that you think that we can do more, we want to hear from you. So feel free to contact us at any time, and all our contact information will be available. Now, is Jim on the line?
I am.
Okay, so would you like to cover the business guidance slide for me, please?
Hang on just a minute. We're talking about the one with the big red graphic on it.
The big red distance, yes.
Yes. Good morning, everyone. First of all, I wanted to give you my direct line. You are free to call me with any and all questions or concerns about the business requirements. My direct line here, my desk phone, 252-5067. Even the smallest question, truly, feel free to call me. If you happen to miss me, leave me a message. I will get back in touch with you. We want to focus on the fundamentals, as Sue mentioned. In fact, our medical advisor just yesterday gave a presentation to our Board of Health about testing in Montrose County, which Sue touched on a few minutes ago. The report is about 20 pages. It can be publicly shared, and I think you would find it interesting reading. That it's a bit lengthy, but there's an executive summary in the beginning that talks about testing options for people when public health, we as an agency get involved for outbreaks, and then lots of other good information. But we want to make sure that we're focusing on the practices so that people don't take a false sense of security from testing results, either positive or negative. And those basics are, the first one, and Sue, I'm so glad you said this, the ultimate social distancing is this: if you're sick, stay away from other people. That is number one. That's the first line of defense. If a person has COVID symptoms or is positive, they need to isolate for 10 days. This is right from the public health order. If a person isn't sick, but they've been exposed to someone, a close contact to someone who has been positive, that's what a 14-day quarantine is for. And that is to try to put a lid on spreading this to other people. Washing hands, staying at least 6 feet apart. Since this is spread by respiratory means, person to person, if you can increase the distance between people, you decrease the likelihood of spread. That's the whole theory behind it. Face coverings, and then normal hand washing, cleaning and sanitizing of high-touch surfaces. These have been the fundamentals that have been in place for the last 8 months now, and we're continuing to emphasize these. As far as the order itself, we were moved by the State Health Department from level yellow to level orange last Friday. I can email anyone the complete public health order, but I think what you're probably most interested in are the capacity limits for businesses, and they are broken down by business or activity type. And the more restrictive on the dial, in this case from yellow to orange, the lower the capacity limits that are allowed. And as Sue alluded to earlier, from day one, our approach to enforcing this order has been education, and that's the way it's going to continue to be. I'll just let you know, we're not out there counting heads in businesses or counting, people in churches or cars in parking lots, but rather encouraging compliance with the order. It's a statewide order. Some counties have additional requirements in addition to the state order, more strict. Montrose County does not. And so please contact me. If you haven't seen the order, I will email it directly, or it's linked on our Montrose County JIC website. So the fundamentals are just keep your employees and customers safe, maintain the distance, offer the alcohol, I'm just reading from the slide, the alcohol-based hand sanitizer. This has been the practice for months now. Signage, encouraging the distance and mask use. As I'm sure you know, a number of businesses actually have it marked out on the floors. And then make sure for your employees, screening for symptoms. And in the beginning of the outbreak, that used to be fever, cough, and shortness of breath. But as we know now, and as our local doctors have emphasized, COVID symptoms can be wide-ranging. It's not only fever, cough, and shortness of breath. And then, of course, if employees are ill, keep them away from work. And then just ensure that your teams know and understand the quarantine and isolation. And then, offer additional options as at the bottom, such as curbside, takeout, online ordering, which a number of businesses are doing already. Want to make sure just to highlight the difference between quarantine and isolation. Isolation is a 10-day requirement. This is from the state order. That's if a person is COVID positive. Quarantine is for someone who has been a close contact of a person who's positive, and that's the 14-day requirement at this point.
Great.
Sue, is there anything else you wanted me to mention right now?
No, I think that's good, but I'm sure we'll have some questions, and I appreciate that clarification on our orders and the business guidance. And I think the main thing for everybody to know is that we have not been we've been unwavering in terms of our approach to the education. I want you to understand that. So people don't like to be told what to do. We feel like we have trust and confidence in our business owners, and we are hopeful and trust that you will do the right thing for your individual businesses. The main point that I'm just going to underscore is stay home if you're sick. Stay home if you want, and encourage your employees to stay home if they're sick. We do a temperature check here at the county every single day if someone comes in. Most of us are trying to work remotely. I can't stay away from the office for some reason, but I take my temperature for myself, even though I know I don't have symptoms. And I will tell you that again, just debunking the testing thing, my husband went to Alaska for 2 weeks, and it was mandated that he take a test from the state of Alaska, a COVID test, as he left the airport for $250. He's been home a week and a half now, and he's never gotten his results. That's the problem with testing, is that unless you can get a very quick turnaround on testing to ensure, and unless you test at the exact right time, it's not going to be necessarily helpful. So you can help us and help your businesses by managing that symptoms. The symptom management is important. So
yes.
And your employees are going to want to come to work. They know that you're working hard. They know that you're working under hardship. They want to support you. But again, the best way they can support you is to stay home if they're sick. So let's take questions now. Do we have any questions in the chat at this point that people want to ask us?
I do want to throw it out there real quick that I did put all of the contact information for our Madam Mayor Barbara Bynum, Sue Hansen, Jim Austin. His direct line is in the chat. There is also the public health orders and the Shop Local campaign of how to stay open safely. So that is all in the chat for your guys' reference.
So anybody have any clarifying questions, anything they want to say? This is the time. We want to hear from you. The other thing I was going to suggest is, because the county is the public health organization that sort of manages this, considering doing a regular business update with regard to the different colors of the dial and how confusing everything is. We want to make sure you're clear on everything. So if you have an interest in that, just indicate that in the chat if you would. We don't want to make it any more burdensome for you. You have a lot to keep track of, but please know that we want to do everything in our power to support you and your businesses.
Absolutely. So it looks like we do have a couple of questions. One is from Krista Bush with Chowdown, and it says, what does a business shutdown look like if you have multiple positives?
That would probably meet the definition of what we call an outbreak site. This is a term that's used when there are two or more individuals that are linked from a sort of a common exposure. And so, for example, we've had several outbreaks. There are hundreds of outbreak sites in Colorado, and so if we receive positive results, let's say from two or more employees, and upon investigation find that those were linked in terms of their exposure, maybe having lunch together or something like that on the job, then that meets the definition for an outbreak, and that's when we at Public Health get involved. And normally there's, and again, the response depends on circumstances, but normally the testing occurs because it's an outbreak site for close contacts, and we do close the business for a short period of time for a deep cleaning and sanitizing. But it's handled on a case-by-case basis.
Thank you, Krista.
Thank you, Jim, for answering that. The other question is, at what point can we get testing without a referral?
Montrose County is not supporting testing referral. Jim, jump in if I'm incorrect on any of that. And that is because, again, we want a medical provider to be involved in the management of if you're getting tested, like for instance, people that were traveling. I talked to my cousin, she goes, well, we're going to all get tested before my mom gets here. And I said, well, you might be negative that day, but you might be positive the next day. So all that is a snapshot in time. It doesn't really give you any real information to act on. So that's why we are encouraging you to connect with your doctor if you have any symptoms. And I'll tell you, our medical director just had a patient recently where she called, she was certain she had COVID, turned out she had flu. Because they tested her for flu, they were able to give her therapeutics for flu because we have therapeutics for flu, Tamiflu, and she felt better in 3 days. So again, we have the regular flu compounded with the COVID. So don't assume it's COVID. Let's assume it's probably just the flu, but don't rely on just blanket testing. Delta has a regional testing facility the state has set up. Varying response times in terms of getting your results back. So again, if you don't get your results for 4 days and that person doesn't quarantine, it doesn't do any good.
That's right. In fact, the testing options are laid out in this document, and Sue, we might want a link to that or just make it available to folks. And you can see, as our medical advisor, Dr. Dragna, has stated, there are 5 ways if a person needs or wants a COVID test. There are actually ways that you can do your own collection at home. You can get a healthcare provider, public health. We get involved as the Department of Public Health when it's an outbreak. We are not medical providers, so short of that, people need to see their own provider. But and just so everybody knows, there was a really good article, and Sue, I forwarded this to you this morning. Forwarded it to our team yesterday. I think it's from the Colorado Public Radio site, and it talks about this, that people can take false assurance in testing, and that's the reason today we're really focusing on the basics, the practices. Stay home if sick. put a lid on the spread of this. Stand at least 6 feet apart from people. Wear a face covering if you're unable to do that. And those are the basic practices.
And Dr. Adragna, and by the way, if we need to go a little bit over the time, I'm fine with that. But Dr. Adragna underscored that if you end up getting tested for negative for a test and you're roaming around the country thinking that you're fine, the much of our spread could possibly have come from people thinking they were fine, as opposed to managing the symptoms. I stay home if I'm sick, right? That's the bottom line, is personal responsibility, which is what we've been talking about for 8 months, which seems like 12 years. Other questions, Kate?
This one is for you, Sue. Can you tell us the current numbers at Montrose Memorial Hospital?
There are currently, you'll see on the dashboard, which is always posted and updated daily, montrosejic.com. It'll say there are 8 that are currently hospitalized with COVID. It actually is 7. One was discharged. When the hospital talks about having capacity issues, they're mostly talking about staffing. Just like you, when somebody's out sick, you have a staffing challenge. The same thing happens at the hospital. And so there are only 7, and the rest of the admissions in the hospital are usually elective surgeries and other reasons that people have to go to the hospital. And as you know, people are discharged every single day in and out of the hospital. I'm assured from the hospital that we are looking good. Our capacity is good. That's one of the important numbers that the county and the city keep an eyeball on all the time. The county and the city on public health calls with all the public health team every single week. We will increase those if we need to, but at this point we do that weekly. So we currently have 14,000 and change in terms of negative tests. We have total of 15,000 and change people that have been tested. Of those 15,000, we have 828 confirmed cases, most of which have recovered and are doing fine and are back at work. Thank you. What else?
That's all we got. That's all she wrote.
Good grief.
If you guys have any questions, please just throw them out there. We're here to answer them for you.
And I guess would for business owners that are on the line, would it help to have a more frequent update as things change? Just put yes or no in the chat. We don't want to be invasive. We just want to make sure that you get what you need.
We also have one more. Does the county have a plan to distribute vaccines when available? Will employees in high-risk fields / businesses be offered the vaccine first?
Oh, good question. In fact, our assistant director here in public health is either having a call today or might have had it late yesterday afternoon on that very question. All the states submitted to the Centers for Disease Control back in mid-October their drafts for distributing a COVID vaccine statewide. So it's going to be driven at the state level, and the state has a list of all the pharmacies, all the doctors, all the sources for dispensing. And so we were having a call as far as our local coordination. So that is in the works right now.
Awesome. Thank you. So what happens when a customer calls to report a business employees not wearing their mask or following other guidelines?
I can answer that. I get a fair number of calls. Our public health line, the commissioners do. These concerns come in through many avenues, and our response is basically the same: is to contact the business, remind them of what the state public health order requires. I make sure, unless they have it already, to email that out to be available for any questions and to encourage their compliance. But we follow up on all contacts.
Right, and I've had personal calls with business owners, and most of those business owners have found that it's really reassuring that you can talk personally with somebody that's can give you clarification on the guidance. I think that's really important. We've also been approached by several of you on the variance program that's been in place in Mesa County. And at this point, I mean, we are looking into it. And if anything, we will do anything in our power that will help you all maintain a customer base. We will do whatever we need to do. If that's, you know, find a similar program that works. But what we're trying to do now is, it's been the county philosophy and the city philosophy. We've been working together on this, that, you know, you are, obviously you're responsible people. You've started. It's a difficult thing to do. I mean, it's a difficult thing to be a business in great time. And we layer this on top of it. I can only imagine the level of stress that you're feeling, because we're feeling a lot of that too here. But we want to be as your partner, not your parent. And so we are asking people to, especially the business owners, you know, you guys are, people want to shop. I guarantee you, I was out Saturday and I saw high mask use, but I also saw a lot of people out and about. It made my heart feel good that people were proceeding and respecting you all, because it puts you in a very difficult position. Many of you are regulated by DORA, and that puts you in a really awkward position to battle a patron that doesn't want to wear a mask. So I was delighted to see that. And out of respect for you, I do what you want me to do. And if there's a mask sign out, I put my mask on. I wear my mask all the time, except in my office. I don't have it on now. But you know, we are your partners in this, not your parents.
Awesome.
Go ahead.
Nope, go ahead, Jim. I was going to ask another question.
No, just real quick, Sue, I'm really glad you mentioned that, and I want everyone to know that our medical advisor, Dr. Adragna, did also, because the state public health order, of course, has the requirement for face coverings. But additionally, that order actually burdens businesses with enforcing that and refusing service to people. We know that's onerous. And so I was glad to hear him say yesterday the same thing that Commissioner Hansen did, is out of consideration for our businesses, don't make this hard on people. And I just want you to know that's our view here at the county.
Absolutely. So this next question, just to make sure that we are considerate of people's time, if we were to go code red in Montrose County, will restaurants be closed, or what does that look like for other businesses?
There are capacity requirements, that is the number of people allowed for all, it's laid out in the order by business type or activity type. And so level red, and I'll answer the question directly about restaurants, is level red is restaurants are closed to in-person dining. There are other similar capacity restrictions for other businesses. They're all laid out in the public health order, and I'd be happy to answer any specifics, but that is the answer for restaurants.
But there's also in Mesa County, because of their VPP program, I just read in the paper today that they were able to keep some of those, to, I guess, discuss with the state that they would not close restaurants. It would be my desire to find a way not to have to do that. I don't know how you guys are going to be able to survive if we keep doing closing and opening and closing and opening. So I will advocate very stringently for you. And I just want you to know that the county feels the same. But we also have an obligation to public health. So if we felt like there was a clear and present danger, we would do what we think is the best. But again, we want to do that with you, not to you.
Yeah, and I've contacted Mesa County twice. I'm going to try again this morning. I need to find out the specifics on what they call their variance protection program, and then of course, you know, we'll decide what we can do after that. So if there is flexibility, then we will use that, use it responsibly. So I hope to find out this morning.
Thank you, Jim.
And it looks like David Fishering raised his hand. David, if you want to go ahead and unmute, you can ask your question.
All right, can you hear me?
Yes.
Okay. So yeah, I think you guys just mentioned it. I'm sorry, I'm running around in the back of my distillery so I can kind of hear, but I think you may have just talked about the 5-star program up in Grand Junction.
Yes.
Yeah, because the thing is, like, it doesn't matter uh, what the county is doing, wants to do. Doesn't matter what we as a business community want to do or are trying to do. The fact is that the code that we're in is governed by these points of positive test results in our community that the state set. We're headed towards red, and God forbid we get to even worse than that and actually go back to staying at home. If we go to red and we're shut down, there is no way on earth that we're going to survive through the winter. One of the things I heard earlier, Sue, I think you were saying about the testing. One of the things with testing is that, like, I don't disagree that it's a snapshot in time, but if all we're testing are people that have all of the symptoms, then you're going to end up with a higher percentage of positive results than if you test more people. The more people you test, the lower the percentage that's likely to have a positive case, and we can lower this trajectory that we're on. Have you guys thought about that at all? In addition to implementing the 5-star program or something like it, for those of us that have been doing everything we're supposed to be doing from the get-go since last March, there are some businesses in town that haven't been doing that, and basically, if we get shut down by not implementing that kind of stuff and not creating a level playing field from the government or the governance perspective, it's really disenfranchised those of us that have been working hard to innovate and stay open and do the best we can. And now we're faced with probably about 4 months where we don't have the tourists that we had in the summer. We possibly might close, and the funding isn't available. The PPP thing isn't happening again. So I don't know. I know you guys are saying that you're behind us and supporting us and everything else, but just sending us the state's pamphlets and things, we already know all that stuff. We've been doing it for 8 months now. It'd be nice to just see something a little bit more proactive.
And the problem is that the way that they gauge the different levels of colors. What's happening in Denver is not happening in Montrose County, and we feel strongly that we need to be managing our own county. And I speak for myself. I can't speak for all the commissioners, but I can tell you that would be the very last resort if we. And the spread that we're seeing does not come from necessarily businesses. It's coming from community spread. So your employee comes to work, but then they go and they hang out with their friends in the evening. And so it's a broad-based education challenge to be able to get people. Look, we're social people. We crave getting together with people. It's very difficult. And to think that we're going to stop this spread just from a practical standpoint is ridiculous. I challenged Dr. Adragna yesterday. I said, when have we ever stopped flu? It doesn't stop. And so again, it's more about making sure that your place of business, and I'll tell you that I will fight for you. If we can if the variance program is the panacea, man, we're on it. We just want to make sure that, we have a small staff here. We want to make sure that we can do it. And as far as enforcement goes, I know from the SO, and we've spoken to the city of Montrose, that unless there's a clear and present public health, threat, we're not going to be counting the people in your restaurant. We're not going to come in and say, you're not doing this. And David, that's where the respect for business owners is. We believe that you can manage this well. I've been in your place. I know you are. I know others are. So again, it's about being smart about this, and whether or not it's not determined what we'll do if we go to red. But I guarantee you from one commissioner that is not going to sit well with me.
Awesome, thank you. So I have one more question here before we wrap up, and then I'm going to turn it over to Madam Mayor Barbara Bynum as she talks a little bit more about next week's call. But this one goes along the lines of what you were saying about will the county or city ever pull licenses or work to shut down businesses that do not comply with state mandates?
We have no plan to do anything like that. I think that's more into the city purview. But no, again, we know it's been hard enough as it is. what we are hoping is that we, through encouragement, and I know you've got all the slides and I know you're sick of this, but we, in a lot of ways, we're flying in the face of trying to respect what's going on at the state and understand what's happening at the state, but also managing for our county, which is a very different animal than, you know, when you live in a rural county, the rules are a little bit different than they are in the city. And so we're really making sure that we walk that fine line to make sure that we keep our community safe, but also, look, it's as important for our economy to stay safe too. We believe that fervently, that it is, we cannot ask you guys to do this again. It would be untenable. I'm not even sure, you know, what's worse, virus or you know, an economy that collapses. We don't want that either. So again, I'm going to say it. If you have any questions for Jim and I, we are available. I gave you my cell. I answer it unless I'm, you know, it's happy hour, but no, I answer it all the time, and we're available to you. So if you have individual questions for your individual business, do not hesitate. And I guess we'll turn this over to Mayor.
Yeah, Miss Barbara Bynum.
Yes, thank you. So in wrapping up, I just want to put a plug in for next week's business roundup call. So same time, 8:30 on Wednesday. And next week we'll be bringing in a speaker to talk about resources for small businesses and nonprofits, all the available grants and loans that are currently available. And she's got a very comprehensive list that applies to Montrose County. She is from the Telluride Foundation, but she has taken on really knowing what resources are available for all of this area. She's going to focus on anything available in Montrose County for businesses and nonprofits. So hope you can join us next week, same time, same place.
And I just want to put a plug in before we sign off for everybody. The county just gave another $200,000 to Region 10 for business loans or business grants, not loans. That's another issue, is that, you know, it doesn't do any good to give you guys a loan where now you're going to be in further debt. So the grants are available. Please apply to Region 10 and fill out your application form. Anything else, Kate?
Nope, that's it.
So I encourage you all. Yeah, what?
Oh, sorry, it's Katie.
Okay.
Guys, this is Katie Jorgensen, Public Information. I just wanted to specify something in regard to the grants. If you have applied before and already received funds, you may still reapply for additional funding. So that's incredibly important.
Thank you, Katie. Great. So again, we're trying to do everything for you. Give us a shout out. Does anybody have any other questions before we close?
Not that I see. I think you answered all of them, and we have the links information below. I will do a follow-up email, or we will post these links on social media and get you those slides. But other than that, we will see you guys next Wednesday, same place, same time, and we will talk about some resources for nonprofits and local businesses.
Happy Thanksgiving, everybody. Thank you for joining us.
Thank you.